Cardiovascular disease, like arteriosclerotic plaques that cause blockages of arteries, is one of the most common causes of poor health and death. And there are many scientific studies that have demonstrated an important association between muscle strength and cardiovascular disease risk. And now in this video, I'll summarize some of the important highlights that you should know. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon in New York. I specialize in sports medicine and arthroscopic surgery. There was a study of about 8,000 men and women, and they looked at muscle strength and cardiovascular disease, and they looked for an association. And they measured muscle strength by hand grip strength. And what they found was that those people who had the lowest strength had a 2 to 3-fold higher risk of developing cardiovascular disease than those people who were the strongest. Why would this be the case? Partly it's because it helps reduce some of the underlying risk factors. For example, increased muscle strength is inversely related to levels of triglycerides, waist circumference, and blood pressure. All of these are contributors to cardiovascular disease. In addition to just relative strength comparing people who are weak versus people who are stronger, there are some studies that actually came up with certain cutoff points for strength. And for example, one study of about 8,500 older men and women over the age of 45 years used hand grip strength as a proxy for overall muscle strength, and they looked for very specific cutoff points. And here they picked 26 kilograms of strength for men and 18 kilograms of strength for women, and they found that those who fell below those cutoff points had about a 20% increased risk of cardiovascular disease. Even small incremental improvements in muscle strength will have a significant impact on someone's risk. For example, there was a study of about 140,000 people, and they found that even a 5-kilogram reduction in grip strength was associated with a 7% increased risk of heart attack and a 9% increased risk of having a stroke. Cardiovascular disease is one of the most common causes of death, and increased muscle strength therefore has been associated with a reduced risk of death from cardiovascular disease. So there was a meta-analysis of 3 million people, and they compared people with low muscle strength to high muscle strength, and they did this through hand grip strength. And they found a 63% increased risk of death from cardiovascular disease in those people who had the lowest strength. As you can see, exercising to maintain muscle strength or build up muscle strength is very important. And there are studies that have shown that people who have low muscle strength and are not physically active, so sort of a double whammy, they can have a further increased risk of cardiovascular disease by 50%. Let's wrap up this video and go over a few key points. Number one, low muscle strength is associated with an increased risk for cardiovascular disease. Number two, low muscle strength is also associated with an increased risk for death from cardiovascular disease. And number three, very important, we need to exercise to build up and maintain our muscle strength to help reduce the risk of cardiovascular disease. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.